Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today. I'm your host, Sharlee Dixon, and today I'm joined by Dr. Alisa Bahl. Alisa is a clinical psychologist and associate professor in the Department of Pediatrics at the University of Virginia, specializing in child and adolescent psychology. She's affiliated with UVA Children's Hospital and UVA Medical Center, where she focuses on neurodevelopmental and behavioral pediatrics. Dr. Bahl was recently awarded an $80,000 grant from the Jefferson Trust to expand access to parent-child interaction therapy, an evidence-based approach to supporting young children with behavioral challenges. Through her work, she's helping train the next generation of therapists while empowering parents to build stronger, more connected relationships with their children. We're excited to have Alisa on the show today to explore how parent-child interaction therapy, or PCIT, is transforming the way we understand and support young children with behavioral challenges through live parent coaching, expanding access to care, and helping families build stronger, more connected relationships. Alisa, thank you so much for coming to the show. Welcome.
Thank you. It's great to be here.
Absolutely, absolutely. So can you just get us started by sharing your journey into parent-child interaction therapy? What is it, and what drew you to this approach, and how it became such a central part of your work?
Sure. So, I guess I'll start going way back. Growing up, I always knew I wanted to work with children. I babysat when I was younger, and I coached swim team as a teenager. And from those experiences, I really understood at a deep level what a difference one positive adult figure could make in the lives of children. And so my intention was always to become a psychologist. And I knew I wanted to work with young children. So as I was going through my training, I sought out schools where I could go to have the opportunity to work with children. And I particularly was drawn to children who were maybe a little bit spicy, maybe put out some challenges. And I felt like I was well matched to work with these kids. So when I was looking for schools to go and train, I found a program at West Virginia University where I had the great fortune of meeting Dr. Sharlee McNeil. And Sharlee is one of the early original PCIT therapists who trained with Dr. Sheila Iberg. And Dr. Iberg was the founder of parent-child interaction therapy. And so that's where I chose to go to school, and that started my path.
Very nice. Can you just give our listeners a bit more description about what parent-child interaction therapy is and where can we find that type of work?
Sure. So I'll jump back into the history a little bit. Like I had mentioned, so PCIT was developed by Dr. Sheila Iberg back in the 1970s. And the theoretical underpinnings for PCIT are really based in good models for parenting, models of play therapy. It also involves social learning theory and attachment theory. And then it ties all of these together with some pieces from Patterson's coercive cycle of parent-child interaction. And so this was really pulled together by, Connie Hanf, if we're going way, way back in the 60s, developed this idea of a two-stage parenting approach, where the first phase is really taking those theoretical underpinnings and building a warm, secure, attached relationship between a child and their caregiver. And then the second phase of PCIT is really focusing in more on the compliance aspects, following directions, listening when told things to do, as parents do. And so the idea is that these two phases of PCIT go hand in hand to make a really robust and effective intervention.
Nice. And before we got on to record today, I was briefly mentioning to you that I got my starts in the social work field and social work world in Child Protective Services. And one of the agencies that we used in Columbia, South Carolina, I they really used PCIT to work with our parents whose children had been removed from their care. And the point of it was to work, one-on-one, hand on with parents and their children that were age 3 to 5, to try to work with them through any behavioral challenges or spicy things that come up, as they do with young children, so that parents knew how to better handle them when they happened. Because, trying to avoid them might work, but being able to really work with them through those challenges really proved to be effective. And all of my parents really loved it, because even though they didn't have custody of their children, they were able to interact with them, and play with them and spend time with them. And it wasn't like a supervised session with me just kind of watching them. They were able to do it at a play area type of thing, where they were able to learn how to be better parents. So it really showed me that it's a completely different way of looking at how you can do therapy or work with parents and children at one time. Can you talk a bit about how PCIT is movement really that changed that landscape of parent-child therapy, and what makes it so transformational for both parents and children?
Charlie, I love that story. And I love these questions that you're asking, because that really gets at the meat of what's at the core of PCIT. One of the things you said, you were talking about these families who children have been removed from the home for one reason or another, whether that be abuse or neglect. And I think this goes back to like a deeper situation. And that is often the parents who find themselves in these circumstances, they didn't have a better model for parenting, or they didn't
Right.
know how to do these skills. And so what PCIT does, like you had said, it starts teaching parents new ways of interacting with their kids. And so I think the beauty of it really is in starting to change that dynamic and starting to teach parents, you could try this with your child, or you could do this, and really doing it in the moment.
Right. And one of the things you mentioned just now is that it really focuses on meeting the child and the parent in the moment of whatever the interaction may be, whichever way it goes, positive or negative, which again is something that I don't know that happens oftentimes when there's family therapy going on, because you're bringing something to the therapist that happened, I don't know, days beforehand or weeks beforehand, or whatever it was. It's not exactly in that moment. And so I would assume then that PCIT really addresses any mental health or behavioral issues, in that moment. Can you talk with us a bit how it uniquely addresses any issues specifically in children under 6, if it does, especially when those struggles are disruptive or hyperactive type behaviors?
Yes. And I love this point that you brought up, because so many therapeutic interventions maybe are focused on psychoeducation. That is,
Mhm.
having a parent or caregivers come in and a therapist talks about what has happened. And then they tell parents, why don't you go home and try these strategies and come back in a week and let me know how it went. Or alternatively, some of the play therapy models just have children come in and play, but then children are sent back out into the home where parents might not have learned new ways of interacting, or they might not know the strategies that are being used. And so the thing that's unique about PCIT is that parents and children are seen together in the clinic, and we set up a play-based interaction there in the moment. What happens with PCIT is that caregivers wear we call it a bug in the ear device. It's like a little hearing device, kind of like an AirPod that they can put in their ear. And then the therapist, if they have the setup for this, can go out of the room. And so now you have just a parent and child in the room together by themselves. And what this does, it creates a really natural type of situation where there's not an extra observer standing over them. And then we have children play with some identified toys, and the therapist is out, and the therapist can talk to the parent with a microphone through that bug in the ear device. And so the parent can hear what the therapist is saying while the child cannot. And then during that time, The therapist is telling the parent exactly what to do. So, for example, to get to your example of the child who has maybe hyperactive or some
Mhm.
disruptive behavior. So maybe they're working on building together and they've built this incredible castle and the Legos are getting built up. And then all of a sudden they topple over. And what we see is children who have difficulty with emotion regulation or who maybe haven't had a model for how to regulate emotion when they get frustrated. Maybe they knock all the Legos off the table. And in that moment, what we do is then we help the parent use the new skills that we've taught them in a way to help their child regulate. So, in this way, really, the parent becomes the agent of change. They're the one who are using the therapeutic interactions, they're using therapeutic language with their child. And if they don't know it exactly, we're there in their ear saying, "Oh, I see she's getting really upset right now. Let's just wait just a moment. We're going to hold on until she comes back. And it looks like she's picking up one of the Legos from the floor. She's brought it back to the table." And I'll tell parents, "Wow, you can turn and tell her what a great job she did picking up. And you're so proud of her for being calm." And so parents, even though they're feeling that tension and that stress in the moment, they learn new ways of interacting. And what they see, and this is, I think, where the magic happens, they really see their child respond differently. The child looks up. The child appreciates that praise. It's a new way of responding. They're not used to hearing their parent respond to them when they're calm. They're used to their parents responding when things get a little disruptive or a little bit loud. And so it's changing that dynamic and it's really changing that parent child dynamic relationship.
Absolutely. Absolutely. I completely agree because again, I would see the same things happen and even the parents will come and tell me like, Charlie, I just can't believe that this happened. And my child usually, when they knock the blocks over because it happens, I would
Yep.
get upset because they knocked the blocks over. And in the place I worked with, it was, 15 years ago. So the technology wasn't there. And literally
Yes.
the therapist would be in the same room and they would just tell them like, "Hey, what if you say, let's try to pick these toys up, or I can see you getting angry, so I will wait." And the parents really came away from that feeling so much more empowered to make positive change. And like you said, not get so frustrated and upset in the moment.
Yes. And I
Yeah.
love that you brought that up because for the past, about past 12 years, I also have been coaching from within the room.
Mm.
And that can add a layer of complexity for
Yeah.
sure,
Yeah.
but it's also effective. And we know that that can work too. And I think that that's really important as we think about trying to get this science out to therapists in the community or in other locations where they have a single room with a little bit of space and we're really making do. And we know that that can be just as effective as kind of the fancier rooms with the one-way mirror. And so that's a really great point that you brought up. And it is so rewarding to see that change and to see parents all of a sudden feeling like they have confidence that they can do this.
Mhm. Absolutely. Absolutely. And so I want to know, I'm wondering, just curious, in my specific situation or interactions with PCIT, it was a court mandated situation. So I am curious, what are some of the most common patterns that you see when parents are coming in when they're struggling with their children's behaviors?
Well, PCIT has really grown in the past 50 years in its development. There are many groups who work with families who are in court ordered situations. And I think that PCIT is uniquely situated to be able to be helpful in these contexts because both the parents as well as the foster parents can be working using the same skills and techniques to try to help the children to have better behavior regulation. And so that's a really nice feature. And they, can do that separately, but still the child's learning the same type of responding. The other thing, which is really nice for court ordered situations, is that PCIT is really an evidence based intervention. And by that, I mean that we're using data on a week by week basis to evaluate child change but also parent change. We're looking to see, are caregivers learning these skills? Are there new ways of interacting? And are we having an impact on child behavior? And so that can be really nice to show the effectiveness of the intervention and making sure that families are really progressing in a manner that would be expected. So I think that's a unique feature of PCIT, but also it's very appropriately set up for working with children and families who are not in those situations. And so
Okay.
sometimes children just come in with a different, maybe a different personality, or maybe they have lower frustration tolerance. Maybe they have ADHD or another hyperactive type of diagnosis. And so part of PCIT is helping children learn to regulate. And so some of the skills help to increase attention, or it helps to increase focus on a particular area. There are also a lot of adaptations for PCIT now, and this has been part of the evolution over the many decades that it's been in development. Some of these adaptations include an adaptation for working with children with autism. And so, as we know, children with autism often have difficulty with imaginary play, sometimes difficulty with following directions. And so this provides a structured approach for helping parents to learn to really play in an engaging way with their children with autism. So that's one adaptation. There have also been some really great adaptations for working with children with anxiety disorders or children with selective mutism. There's a trauma focused module as well, which is so important now as we're having increased awareness about the impact that trauma has on children and the parent-child relationship. And so there's a trauma-directed interaction that's a part of an adaptation as well.
Awesome. Awesome. And speaking of adaptations, so I know personally, just since the pandemic, we've seen rising numbers in the rates of anxiety and behavioral issues with young kids. I mean, where I am in the Southeast, I'm seeing it. I hear from people across the country, across the world, that our kids are just different after that experience, that level of trauma, the uncertainty, just everything changed for not just the children, but for us as adults and as parents as well. How has PCIT been able to adapt to meet these new challenges?
Yeah, and we saw actually the rates of anxiety and depression were increasing even pre-pandemic. And then what we saw is with the pandemic, those numbers just skyrocketed. And you're right that this is a huge concern for our society today. One thing that has been really helpful in trying to help get PCIT out to families who perhaps live further from a community service board or another mental health service provider is what's referred to as iPCIT, or internet-based or telehealth-based PCIT. And so there's been some new research studies looking at internet-based PCIT. If you have a good, connection, which can be
Right.
tricky as well, especially for some of our folks who are living in more rural communities that we have. I'm out here in Virginia, so we have some folks out in Southwest Virginia, and sometimes our connections can be a little bit tricky depending on the way the wind blows. Um,
Absolutely.
but if you have a good internet connection, then we can provide PCIT via telehealth. And families have found that to be really effective. And there's some new research studies that have just come out that are demonstrating equal results from internet-based PCIT as in comparison with clinic-based PCIT. So this has been really great. Two other things that I think have been developments is PCIT that's designed for toddlers. You had mentioned kind of a limited age range. And so
Hmm.
PCIT originally was designed for children between the ages of 2 to 7. And there is a toddler PCIT, which involves a little bit more emotion regulation and teaching self-soothing skills, which is really great for younger children. Also, that can be really effective in helping children who have perhaps in utero substance exposure. As we know, neurologically, these children sometimes have higher levels of dysregulation. And so teaching and incorporating this as part of PCIT can be really helpful for these children and families. And then on the other end of the spectrum, Dr. Corey Linneman has built manual for PCIT for older children. And so the idea is scaling up in the age range a little bit beyond age 7 to help families have evidence-based intervention for a little bit older children.
We'll be right back after a word from our sponsor.
Are you preparing for a licensure exam in psychology, social work, marriage and family therapy, counseling, or behavioral analysis? AATBS is here to help. We have been supporting behavioral and mental health students to prepare for their licensure exams for more than 45 years, working with over 1 million students to succeed on test day and move on to the next step in their career. With products ranging from comprehensive courses to quiz banks and delivered live online, self-study online, and in print, AATBS has test prep solutions that meet every student's needs and learning styles. Visit us today at aatbs.com. That's aatbs.com and use promo code BHT15 to save 15% off your next purchase.
That's really cool. I really enjoy how PCIT it can be adaptable and you can change it and mold it to work with, because I would have thought previously, it doesn't reach a lot of age levels, but with the change in adding in older children in there, like it is really something that can be used with a wide range of children and their families. That's pretty cool.
Yeah. Yeah, it's nice. I feel like as, good psychologists and good therapists, we're always trying to take good evidence-based intervention and do what we can to try to reach as many people as possible. Because when we know we have something that works and something that has really high levels of parent and caregiver satisfaction, we want more people to be able to have access to that. We want to make sure that families are getting good therapy, that they're not spending their time and money on something that's really not making a change and not making an impact for their families.
Absolutely. Absolutely. So speaking more of adaptation, because I'm really loving that it is adaptable in that way. It is my understanding that you've worked on adapting PCIT to work with Head Start and Head Start teachers. I'm a big fan of Head Start myself. Actually, there are lots of social workers that work in that same realm. So I'm curious to
Yes.
hear what you learned from that experience and how you were able to adapt that, because in many ways, childcare providers are like second parents to children, and they really can be monumental in helping to mold a child and be that positive adult that they have around. So can you talk to us a bit more about that experience and how to adapt it for classroom-based interventions?
Yes, I love that you pulled that up. I have this is going back to my training days many years ago, back when I was working with Dr. Cheryl McNeil, and we had this idea of taking what we know was good evidence-based work that we know is working with parents, children with young children. And so we thought, well, let's do this in a group setting. Let's do this with teachers. I had been a preschool teacher for a couple of years before going back to school. And so I had kind of the unique experience of being in the classroom and understanding some of those challenges, and really felt like we could dovetail the knowledge that I had from my preschool experiences with the knowledge that I had from the parent training, and pull these together. And so we did. I went out into a couple different Head Start programs, and these were teachers who were interested in kind of learning new skills. And I think this was the first time that PCIT had been brought into a classroom setting. Now that we are 20 plus years later, there are some folks who are really focusing in on doing what's called now teacher-child interaction training, where they integrate those same skills. And there's some different ways that they are going about it, and some different modifications they have made from what I had done originally. But the idea was that same thing. We had a teacher wearing, and now it's much easier with technology. So now they can just use their Bluetooth from their phone.
Mhm.
And so they're in the classroom. Gosh, back when I did it, we had like this wire and this equipment, and I had to see if it was working, and had it was like a little tape recorder. It's really a different era. But now they use just like a Bluetooth device, and then a therapist might sit kind of in the back or outside of the scope of the classroom and help teachers to catch, part of the idea is helping parents and helping teachers learn to recognize when behaviors might be going down a different path, because you can always intervene in a preventative way. And so giving teachers a response that they could use very quickly, that's consistent, predictable, delivered in a neutral, calm tone of voice, is really empowering them in a way so that they have broader authority with kind of a warm and gentle approach in that preschool classroom setting or in that Head Start classroom setting. And so it is a really nice way to take the clinic information and put it out there where so many children and teachers can benefit for years.
Absolutely. Awesome. Awesome. Okay. So I've heard you mention a few different times here, and I saw it in the research as well, that parenting really can be compared to like sports coaching, which was interesting. And so as a parent, I completely agree with this. So my children are both in sports, multiple sports. And so I watched that interaction with them and their coach, and the coaches just have this skill to be able to teach the children something, whatever it is. They practice it with them, help them master it, and then they turn into these, great sports players. So I completely agree that, parenting can be somewhat like sports coaching. Can you talk to us a bit about that, that comparison, or about how PCIT can turn parenting into a skill set that can be taught, practiced, and even mastered? And side note, I love this idea that it can be, because I have even often said to friends, and I think it often to myself, parenting does not come with a guide, but PCIT might actually be that guide.
Well, you're right. Yes, anybody can become a parent. There's no license.
It's
There's
not no book,
no test you have to pass.
none.
You're absolutely right about that. Thinking of the coaching analogy, I love this, and I feel like it hits on two different levels. One of them is in therapists teaching parents skills. So if you think about like, what's the hardest thing you've ever done? And for some people, that might be, giving a presentation. For some people, it might be a sports activity. For some people, it might be climbing, like going on a trek and climbing this mountain, taking on a new athletic skill. So for many of these types of situations, we enlist in the help of a coach. There's somebody who's telling you as you're going along, just like you said for your kids out on the field, yes, that's the way to do it. Now turn and go up the field. You're right where you need to be. Back up a little bit. Oh, try this next, right? There's someone telling them what to do. And in telling them, they learn in the moment exactly what they should be doing or where they should go next. And so I think about PCIT as doing the same thing for parents, because parenting is the hardest job there is. And wouldn't it be amazing if we could have a coach there telling them, you're doing it right. That was a great way to handle this. Let's back off a little bit. Oh, why don't you try saying this next? Right? It's really coaching in the moment. And that's when parents gain those skills, just like your kids out on the field.
Absolutely.
Right? They learn like, oh, that's how I'm supposed to do it. Parents can have this aha moment, like, oh, that's how I'm supposed to do it. And like you said, you can see the look on the parents' faces. I remember this time I was coaching a parent, and we were on the second phase where it's really helping parents to teach their children to follow directions and to listen to when they're told something to do, but also giving parents a calm way of doing that in a neutral, consistent, positive tone of voice. And so the first time, I went to tell this parent, okay, we had practiced. I taught her the skills. We do a little role play back and forth with me and with another therapist in the room. So they were ready. And so I said, okay, we're going to try our first instruction. And I see her eyes like get really wide. And she looked up at me. And so I said, okay, first we're going to tell them the rationale. I want to turn with the marker. And so she said, I want to turn with the marker. Please hand me the blue one. And she said, please hand me the blue one. It was the one that her daughter was coloring with. So this was going to be really difficult. And the daughter held up the marker, and she looked at her mom. She said, here you go, mommy. And the mom said, thank you so much for listening. And I remember her eyes got really big, and I could see the big tears welling up in the mom's eyes because she had done it. And if things hadn't gone that way, that would have been okay because I would have been there to coach her through it. And we had that success, and that parent felt so good. And it gave her the capacity to think, oh, yeah, I can do this and I can do this at home. And that's what a good coach instills in our children. It's not that all of our children are going to wind up in the Olympics, right? Or in the NFL or the
Yeah.
NHL, whatever it might be, right? It's just this confidence. And what do you grow? How do you learn from this? And that's what we're doing for parents.
Absolutely. Awesome. Awesome. And I tell my children all the time, I'm not putting you in sports so that you can go, I don't know, be in the MLS. That's not even the point of this. I need you to learn other skills that I don't necessarily know how to teach you. So that is a perfect analogy. And it's exciting for the parents that you're working with. Absolutely.
Yes.
So, let's talk a bit about your recent work. So, from my understanding, you are scaling access through a new clinic and maybe even some workforce training. So, how do you envision this improving access to evidence-based care for underserved areas?
Thank you. Yeah, I'm really excited about this project, and I owe a huge amount of thanks to the Jefferson Trust Foundation, which is here at UVA, and the Ashley Thompson Manning Health Innovation Award, who have helped make this possible for me. The goal of this project is to train more therapists starting at UVA and also graduate students who are master's level therapists already.
Okay.
And then the third step is to really train therapists in the community. And so the reason is I think about this as like a cascading model. The idea is I can provide so much therapy, in the office by myself. But what we really need to do is grow the workforce because, as you had mentioned earlier, we're in the midst of a mental health crisis.
Yeah.
And we don't have enough therapists providing services to children and families in any community that I know of. And so the more that we can train therapists who can then go out and provide this therapy, and some of these therapists can become higher level trainers and train more therapists at their agencies, we're starting to build out a train the trainer model so that we have more access to care. And I think that that's really the key in trying to help children and families in the communities where they reside so that they have the best evidence-based intervention and the best opportunities. We know that if we intervene early with these children, and that parents have learned skills, that this will carry with them throughout their lifetime. We know that children who have intervention when they're young are less likely to have mental health problems as they get older. We also know that these children are going to grow up and be parents themselves one day. And so if we are changing this step by step by training therapists here, training new graduates who are going to go out to wherever they land and open up their practice, that we're really going to make a difference in the lives of children and families.
Absolutely. Absolutely. So, for someone who is interested in becoming a certified PCIT therapist, what qualities or training paths are most essential, and how can they really get into using this as a treatment modality?
So PCIT is designed for folks who have a master's level in some sort of mental health field. So that could be, social work, counseling, psychology, behavioral work, in any of these areas. And then they can go through a course to become a certified PCIT therapist. There are different trainers, such as myself, who will provide workshop and consultation. So the way the training works is if you have your master's degree, then you can sign up for one of these workshops or courses. And so part of what I'm doing with this grant here is I have the time and availability to provide this for some of the therapists in the community here. But there are many of these offered. You can go to the website, which is pcit.org, and that will take listeners to the PCIT International website. They can learn a little bit more about PCIT and find these trainings in their community. So, for example, I recently was part of a training program in Tennessee where they are working with the state to train therapists who are already in community mental health centers across the region. And we're looking to do some of that here in Virginia, where we're training therapists who are already providing services in the community service board across several different localities. It's 40 hours of training initially,
Oh, wow.
which is then followed up by approximately a year of consultation calls with a certified trainer. And those consultation calls are so that when therapists are out there in the community learning this, they can come back and say, oh, I had this challenging situation. How would you address this? And so expert trainers then can help problem solve as a group process. And then the goal is for them to get two families to get all the way through completion of the therapy in order to become a licensed therapist.
Got you. Nice. Okay. Okay. And so then on the other side of that, so for parents listening who might be struggling right now, what is one thing you'd want them to know about what's possible through PCIT and how can they find therapists using this treatment method?
So again, there is a list on PCIT.org, and there's a parent section on there that can help parents find a provider for PCIT. But I think one thing that's really important to know, and I've worked with a lot of families who have felt pretty hopeless by the time they get to me. I know I've had families who sometimes say, I love my child, but I don't like them very much.
Yeah.
And that's just heartbreaking because we know that these children are good little kids, right?
Yeah.
But they've learned behaviors or they're engaging in things that are just making things really difficult for the family in that moment. And I think the idea of thinking about it as in that moment is key. We know that children can learn new behaviors, that parents can learn new behaviors. Like we've seen it, you've seen it in the families you've worked with. Like we know that this dynamic can change and it's just a matter of learning. And so I think about parents who've been struggling for years and they finally gotten to that breaking point. I hope that it's possible to convince them that you can take 12 or 14 weeks, just a couple months after doing this for so many years, this cycle that hasn't been working. Take a couple of months to really focus in and do this practice and do this intervention. And you're really going to change the course of where this relationship is going and really see that warmth and that love and that actual liking is back in that parent-child relationship.
Awesome. And because I love a good story, I want you to tell us a bit about a family that you've worked with. So you did mention a little bit ago about a parent and just being able to see the change happen in her when she saw some things differently in her child. But can you speak to a story about the power of helping parents see their child differently? Because that is exactly what oftentimes happens. I've worked in the school system for many years at this point. And a lot of times the parents do get to the point where they are just frustrated. They've had enough and they no longer see that child as this great blessing that they did when they had them. And so being able to see that child change, that you have changed yourself. So can you share a story or even a moment where that shift really stood out to you?
So I have a story about a family that had lots of levels of complexity. Their child had genetic disorder and a developmental disability. And so this family had been going through several different paths. One I know that you've talked about before, they had been down the route for getting applied behavior analysis, and that was still part of their repertoire of what they were doing with this child. But they were finding that they didn't feel like they knew how to play or that their child really had these other play skills. And so we started to work on ways that the parent could help to facilitate that interaction, that back and forth interaction. And what we saw was a child who we really did some adaptations. We really had to shorten our therapy initially just because he wasn't able to make it through the end. And so we started short and got longer and longer and longer over time. as this child started to understand and started to really benefit from the back and forth that they had with their parent that had been a little bit different than they had had in the past. This child also had some speech and language difficulties. And what we saw over time with the therapy was that the speech was increasing, the language was increasing, the understanding was increasing. And so that was a really robust finding as well. And I remember the first time we took, one of the things we do in PCIT is we work on generalization. And so once things are going pretty well in the clinic and pretty well at home, we go ahead and take things out on the road a bit. And so we were walking around outside this little patio area. And this was a family who one of the parents had said that they never would go out in public by themselves with their child and with the sibling because it was too stressful. And so here we got to really do this in a safe area, but with me following along, kind of shadowing behind. And again, this family was able to actually really go and then practice with us on our patio and do a couple practicing skills. And then they came back the following week and she said, guess what we did? I said, what? She said, I went to the park with the 2 kids by myself and it was great. And I thought, that's it. That's the idea. We're just trying to open up the world, help parents, and help their children.
That's awesome. That is awesome. Thank you so much for sharing that story. Because not only did the parents see their child differently and what they were capable of, they saw themselves differently too. That's awesome.
Yeah. And one thing related to that, and I didn't mention this earlier, but the other thing, in addition to there being this child mental health crisis, is we know that parenting stress is at an all-time high. In fact, the Surgeon General put out a statement indicating that parenting stress is at an all-time high. They see this as another epidemic. And
Wow.
one of the things that's really neat about PCIT is just what you mentioned, that we're helping children's behavior and we're impacting their mental health. But really, we're also empowering parents and we're impacting parental mental health as well. We know when parents have children with disruptive behavior problems, that their rates of depression are much higher than parents of children who don't have disabilities. And so by doing an intervention like this, we're really targeting the mental health needs of both.
Awesome. Okay. Well, where can folks learn more about parent-child interaction therapy? I'm specifically very curious about how things are going to go with the Jefferson Trust grant that you received and even more of your work. Where can we find it?
Thank you so much. So, you can find me at UVA Health Children's on the link to pediatric psychology, which is through the UVA Health System website. But also, I really refer listeners back to PCIT.org. That will take them to the PCIT International website where they can learn more about PCIT and find therapists in the community, both who provide PCIT virtually on telehealth, PCIT providers who can provide PCIT in different languages because there have been language adaptations to meet those communities' needs, as well as PCIT in person that's in a nearby area to them.
Awesome. Well, thank you so much. I really appreciate you speaking with us today.
Well, I loved having the opportunity to chat with you about this. I think it's really exciting. And I hope that this reaches some people who are interested in learning more of what they can do for their children and families.
Awesome. Thanks. And thank you to our listeners for taking the time to join us. Make sure to follow us on our social media at Instagram, TikTok, LinkedIn, and even on YouTube under Behavioral Health Today. And if you like our show, give us 5 stars and leave us a review. That helps our show get discovered and share the valuable insights in each episode. As always, the resources for this episode and an archive of all of our other episodes can be found on our webpage at triadhq.com/BHT. And we look forward to having you back with us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.